these type of
Well,
injections?
yes. Right now we do them all at the hospital because, like you said, we need, and for especially for vertebroplasty, which is putting the cement in, we need some conscious sedation. We need them to be sort of a little bit out, sort of what we call twilight, to keep them out. Same kind of drugs that are used for colonoscopy, Versed and fentanyl, pretty much. And that makes the patient sort of sedate, and that's helpful when we're putting the cement in. And also I use a lot of local anesthesia along the pedicles to provide pain relief and to not cause pain during the procedure, actually. So yes, we do those in the hospital. And then the office at Diagnostic Imaging in Milford, we basically do a lot of just the reading of the films, the MRIs, the CAT scans, the plain films. So we use both facilities to both diagnose and treat.
And going back to the steroids, I have patients in my office also because I give injections for knees and for shoulders as an orthopedic surgeon. Once in a while, more from women than men usually, they worry about the amount of cortisone or steroid that you use because they ask if they're going to grow hair, or they're going to get bigger muscles, or they're going to gain the weight. And I generally tell them, which I think you probably tell them the same, is that it's not like you're taking oral steroids for a prolonged period of time. That's when you see the problems that can occur with prolonged steroid use. But it's more a very small amount, it's a localized amount, and generally you can have a few of those injections, but it should not cause you any of the problems that you hear generally about steroid use.
Correct, yeah. You're right. I mean, over the 12 years I've been doing this with the steroids, haven't seen any of those effects because they're not in your system. They're not really injected into your system or taken orally, like you said. They basically are into a confined space, and then the body reabsorbs some of it, probably not even detectable in the blood system.
So can you refer to it maybe almost like taking a Motrin or ibuprofen and putting it where the problem is? That's
Pretty
what a
much.
steroid injection is.
Pretty much, yeah. I mean, yeah, and some of the steroid is not really taken up by the bloodstream, so it stays in local area, so it's not really affecting other regions of your body as much as taking it, like you said, orally.
And let's talk a little bit of technology.
Okay.
Because if you look back at 50 years ago, for instance, most of the diagnosis, most of the treatment was done just with x-rays. And there was a little bit limitation of what you can do because you don't see the soft tissue structures. You definitely don't want to put a needle where you're not sure the problem is. But as time kind of went on, CAT scan became helpful, and then now the MRI is very helpful. Now, the MRI also has different type of magnetism, essentially. So it works in Tesla, but it can work anywhere from 1 Tesla to I've even seen a 4 Tesla machine.
Mm-hmm.
And a 4 Tesla machine is almost like driving a Lamborghini versus, let's say, a 1 Tesla machine. You ride your bicycle. So it doesn't matter for what you do to look at such fine detail, or is it enough to see kind of the little more of the bigger picture?
Well, I take pride in my confidence in reading these. So even down to a 0.7 open magnet, if you see the disc and you see what it's causing to the spine, is it going into the foramen or is it going, into the spine causing stenosis? I can see that. So, yes, of course, with the more Tesla, you get much more defined, resolution. You maybe could see the nerve roots much better. But when you already see on a lower Tesla magnet that there is a disc and it's causing some problem, you put that together with the patient's history, you can pretty much direct your therapy based on even a 1 Tesla magnet.
Well, I bet it also takes some of your expertise, your subspecialty, and your training to be also confident in what you see and what you read, and knowing enough about it to say this is the treatment that I would render to the patient.
Correct. And experience speaks for a lot.
Absolutely.
So.
And I do have patients that go to you that speak very highly of you.
Thank you.
Which is always very nice because this is what forms kind of the teamwork of what we do for the patient, how we take care of the patient.
You're right. And one thing that I think that I want to mention is that going to conferences, of course, like as doctors, are very important. And I always take home little pearls or take home messages. And one thing about 5 years ago that I took home that it really provides a lot of patient relaxation is the fact that I use a very small needle for the initial dermal injection. I use a 30 gauge, and I also put bicarbonate in my lidocaine, because lidocaine has some acid in it, HCl, so the bicarb neutralizes it. The patient doesn't really get that burn. So they were sometimes they come off the table, that's it. You know, so it's
That's a caring doctor right there.
yeah, and I always follow up with a phone call that same night to make sure that they're fine and make sure that, you know, how are they doing, because, you know, both for the patient and myself, it gives me pleasure to know that they're doing better.
And I'm sure they appreciate it.
Yes.
We're going to be right back, and we're going to speak about spine fractures and some of the treatments that can be rendered. Stay tuned.
Behind the wheel, there is no such thing as a small distraction. A public service reminder from the American Academy of Orthopedic Surgeons. Speak out against distracted driving at decidetodrive.org.
From Maine to Maui, thousands of high school students across the country are getting in on the action by volunteering in their communities.
It's great helping others, and it feels good too. Are you in? Whoa!
Anyone can do it. All it takes is a little time. Are you in?
Action teams of high school students are joining Volunteers of America and Major League Baseball players to help train and inspire the next generation of volunteers.
It's easy to start an action team at your school, so you too can get in on the action.
Are you in? Get in on the action at actionteam.org.
Hi! About a new medical website designed especially for older folks. Website, you say? I can't work on computers, they're not senior friendly, blah, blah, blah. But the National Institutes of Health fixed all that. Now you can make the type bigger, increase contrast, even make it talk to you.
Arthritis.
Just go to NIHseniorhealth.gov and get the best medical information available anywhere. NIHseniorhealth.gov. Built with you in mind.
Welcome back to Healthcare from the Hill. We're here with Dr. Vito Errico from Diagnostic Imaging of Milford, neuroradiologist. At this segment, we're going to talk a little bit about compression fractures and some types of spine. But before we even go to that, because we spoke about MRI at the last part of the segment before, I'd like to show you maybe what an MRI of the brain looks like. If we can go to that image, please. MRI of the brain essentially will show you what your brain is, the fluid around it, the skull around it, and that's really essentially the engine that drives down the spine and sends all the signals down the spinal cord to the roots, which essentially exit your spine. After that image, we're actually going to go into fractures. Now, there's different types of fractures that can occur in the spine, but obviously, neuroradiologist has a role in some of those fractures and treatment, and that's actually not surgery, it's more of a procedure. Again, when you look at the spine starts at the cervical, which is your neck, thoracic, which is your mid portion, and your lumbar, which is the lower back, and it articulates down to the pelvis and obviously your hips. What we want to do next is speak to you about what type of injuries can occur. Now, fractures can occur multiple ways. You can obviously fall, you can land off a building, you can fall off a ladder, you can be involved in a fight. But what other type of fractures can occur, even which are atraumatic, without any type of trauma? Those are really osteoporotic fractures. And osteoporosis essentially is loss of your bone composition, which makes your bone weaker. And spine fractures or vertebral fractures can occur even by just leaning forward and lifting something that is heavy. And if you look at your vertebrae, which is essentially one block on top of the other, and the disc is in between, just like our model shows, the vertebrae can get weaker. If they get weaker, they can collapse. And that's what's called a vertebral fracture or compression fracture. If we go to my models for a minute, if you look at this, this is essentially showing you a vertebrae. The disc will be above and below, and it's one block on top of another. If this is one block, you can look in the middle, called the cancellous bone. It has excellent structure, which is essentially hard, interconnecting with itself to form a very hard type of material, which helps prevent any collapse of this part to this part. What happens when you have osteoporosis? You start losing the bone from in here, and you end up with something like this. And you can see how you can look right through this bone where you can't look on the one on my left. Again, looking at this side here, same thing. And you see how the height of the vertebra actually collapses. And you go from having a nice stout vertebrae body to one that is more collapsed. And that's why you sometimes see in older individuals where you lose the height. Essentially you lose the height because your vertebrae is collapsing. Once it collapses, that can also be associated with pain. And it just doesn't collapse from the top and the bottom, and actually it can crack all the way in the front, almost forming like a triangular type of injury. And the neuroradiologist can help that in one way or another, which we'll get into in just a moment. So if you look at these two models here, again, this is your vertebrae, now showing your elements in the back, called the spinous process, transverse process. You have your lamina and pedicle here. But the vertebrae body, the big piece that's right in the front, where the disc sits above and below, that's a stout part of your spine. And you can see how it's nicely, almost like a rectangle. When you have a compression fracture, if you look from the side, you can see how that part of the vertebrae essentially collapses down and essentially becomes much thinner. So when you look at one side next to the other, you can see this is nice and large. This is where your height is still there, where the other one is collapsed. Now once it collapses, it cannot go back to where it was before. What do we do about that? Well, let's speak to Dr. Arrico. Once you have this compression fracture, what can be done?
Very good anatomy talk on this. And basically what we do is when we look at that compressed vertebral body on the x-ray, we use live fluoroscopy to guide us to put needles into that compressed vertebral body, which is this one. So we use landmarks. As radiologists, we know our anatomic landmarks. So under live fluoroscopy, we find where the pedicle is, okay? And what we call that is the eye of the Scotty dog. Once we see that eye, and we put this 11 gauge needle into the pedicle, and it goes into the vertebral body. And I'll show you some x-rays taken during my procedure to really solidify that thought. And under fluoroscopy, we inject this barium-coated PMMA, or polymethyl methacrylate. And as we're doing that, we're able to watch the cement so it doesn't leak into any other area that we don't want it to go. So it's a very safe procedure in good hands, and it really provides pain relief pretty quickly. 85% of patients get pain relief, within the hour, and that's pretty amazing in medicine, that kind of number. So it's a very satisfying procedure because you get to see patients do really well. So not only are we diagnosing these fractures, you actually get to see a good outcome, and patients, get up off the table. A lot of older women who have osteoporosis and get these compression fractures, their quality of life improves